So let's actually have a honest guide for your entire hair transplant journey. Is it painful? How soon can you see results? What is the entire journey that you're going to go through? So first understand that hair transplant is a surgery. Though it's a minor surgical procedure, but ultimately it is a surgery. It should be only done by qualified surgeons, not by beauticians, not by technicians, and definitely not by unqualified doctors. The procedure, firstly, is done under local anesthesia. Local anesthesia, if given into a vessel or not in the right places or very large doses, can be harmful to you and cause a great deal of harm to your body. So, definitely always go to somebody who understands what local anesthesia is, the proper dosage, and he's well trained to deal with all the side effects of local anesthesia if they occur. During local anesthesia, you will feel tiny bit of needles going into your scalp to give the anesthesia drug. This is made as painless as possible by cooling down the area by using vibrators. So hence you do not feel much of pain. If I have to grade the pain on the level of 1 is to 10, 10 being the highest, it would somewhere be 1.5 to 2 or maybe even less. A lot of patients say that they felt tiny small needles going into the scalp. They barely felt a small prick, but they didn't really feel any pain. Once the anesthesia takes effect, then you will definitely not feel anything at all. What about the pain after the procedure? Yes, because you made tiny holes, you have to remove the grafts and tiny punctures here to put the grafts, you definitely are going to feel some amount of discomfort and tightness. There's also going to be some amount of scabbing, redness, and swelling. Swelling in our case is minimum. The technique that we use is patented implanter one step technique, which makes the possibility of swelling very minimum. But even if it occurs, it normally goes away in 2 to 3 days. What about the scabs and the redness? The scabs and the redness on the back of the head disappear in 3 to 4 days, and in the front, where the grafts are implanted, they disappear anything between 5 and 7 days. Can you work in between? Yes, if you don't have strenuous work or physical activity, you can definitely work in between. You can wear a loose cap or a loose hat. You can even go to work, okay, as long as you're not bothered about the way your head looks. Now, shock loss. Often we read about shock loss, but we confuse what it is. So, shock loss is when if you put the grafts, if you make large holes or you put the grafts too deep or you pack them too close, then the surrounding hair which are already existing will actually not get enough nutrition. All the nutrition will be diverted toward the graft and they will actually fall. So that is known as a process known as shock loss. How to prevent this? By treating adequately with vitamins or with PRP or exosomes or growth factors or other treatments which are used post operatively in order to minimize or reduce or actually even abolish shock loss to a large extent. When I started doing hair transplant, I would see that the hair take around 8 to 10 months to grow. But now with newer techniques, we can see hair growth in as early as 3 to 5 months. So, when can you resume normal activities? Like I said, normal household work or even normal work in the office, you will start within 48 hours. But if you are too conscious about the way you look, if you are in the marketing field, or if you are in a field where you have to meet a lot of people, maybe you need to take 5 to 7 days off till the scabs kind of disappear. Yes, you can start your normal walks in 3 to 4 days. You can start brisk walks in 5 to 7 days. You can start slow jogging in 12 to 13 days. And after 15 days, you can do every single possible activity that you want to do, physical activity that you want to do. So, yes, the recovery is very, very fast and it's quite seamless. And the final check for your results, patience. Well, I always tell my patients that it takes 9 months for the baby to come. Similarly, at least give a few months for your hair to come. It typically takes 8 to 10 months. In most of the cases, you can see hair growth between the fourth and the sixth month. But yes, to get a proper good dense result, it's just like a baby. So yes, 8 to 10 months or 9 months is the optimum time period. Always go to a board certified surgeon or to a qualified clinic with a good experience and qualified team to actually take you through the entire process of hair transplantation and the journey of hair transplant and hair loss.